A remarkable recovery. The city of Brampton, once Ontario's COVID hotspot, is now stable with a soaring vaccination rate. But getting here was an uphill battle. Tonight, I talk with Mayor Patrick Brown about the fight to get this virus under control, the unique challenges in this city, and one thing that kept him up at night.
There was a number of issues that we were stubborn, determined, and unrelenting on.
The images are jarring. COVID patients on ventilators being bused or airlifted to faraway regions. The city of Brampton was on fire, with William Osler being one of the busiest hospitals in the country. At times, every single patient in the ICU was an essential worker.
The biggest challenge was to make sure the government recognized that Brampton faced a different reality. At the beginning of the pandemic, there was almost a stigma towards communities that had higher COVID rates, not recognizing that we were critical to Canada's supply chain. You know, if I look at Brampton's major employment sector, transportation, logistics, food processing, we had food and grocery stores across the country because of our essential workers. We had medical supplies coming into the country because of our truckers.
During the third wave, COVID cases began to skyrocket. Brampton had the highest test positivity rate of any city in the country. Mayor Brown was advocating for isolation hotels to help multi-generational households quarantine. And when vaccines started touching down, he, along with Dr. Lowe and Mississauga's Mayor Bonnie Crombie, started sounding the alarms.
There was a point in the third wave where I know I was frustrated, and I expressed to the Prime Minister and the Premier that if you have a fire and there's fire trucks available, you don't send the fire truck with a cup of water. You know, I was exasperated by the slow response. But when they changed approaches, when they actually came with those vaccines and said they were going to have a hotspot strategy, you know, I really felt a sense of relief.
And Brown says pushing the province to provide paid sick days for essential workers was perhaps the toughest battle.
Do you think that things could have been different if workers were given more paid sick leave and much sooner?
I think if we had paid sick days well in advance of the third wave, it could have changed the dynamic. I think one of the reasons we had a third wave that was as ugly as it was we didn't have that tool. When Dr. Lowe was sharing with us the data that a significant number of our COVID cases were related to individuals going into work sick, and that was so disheartening. The fact that we had families having to make the choice, do I go into work sick or do I put food on the table? That should never be a choice presented to a family. And for a good portion of the pandemic, that was the choice that they struggled with. And it was one of the reasons that we had such ugly COVID numbers in Peel.
And one thing that keeps Mayor Brown up at night is thinking about his grandmother, 107 years old, and the toll this pandemic has taken on those living in long-term care.
You know, there was over 40 seniors in her residence who passed away during the pandemic, including half the table that she had lunch with every day. That was a scary period, and so when I think that, you know, that kept me up at night, I know there's a lot of families during the pandemic that face the same fears and worries.
And as we end the year in another uphill battle to mass vaccinate against Omicron, this is how Mayor Brown sums up 2021.
So it's been a year of resiliency where our community stepped up. We looked out for one another, and we've got through a storm.
Shauna Hunt, City News.